Mental Health First Aid Australia acknowledges Aboriginal and Torres Strait Islander people are the traditional custodians of the lands, seas and waterways where we live and work. Mental Health First Aid Australia pays respect to Aboriginal and Torres Strait Islander elders, past, present and emerging. Adolescence is a time of important change and development. It is also a time when mental health problems such as depression and anxiety first emerge. Mental health problems can seriously affect young people's development, their ability to attend school and maintain their roles within families and communities, all of which can have a lifelong impact. Mental health problems affect Aboriginal and Torres Strait Islander young people at high and increasing rates. We know that if a young person does experience mental illness, that they are more likely to experience episodes in later life. Getting support early can reduce the likelihood of future episodes. This is where mental health first aid training can help. Most people are familiar with physical first aid and the idea that when you attend a physical first aid course, you learn the skills and knowledge required to recognise and respond to life-threatening emergencies and provide a first aid response to a casualty across a range of different situations. Mental health first aid training adopts a similar approach. Our courses teach participants about the different types of mental illness, and through our practical action plan, you learn the skills to recognise and respond to someone experiencing a mental health problem or a mental health crisis. Our range of Aboriginal and Torres Strait Islander mental health first aid courses have been developed and reviewed in consultation with Aboriginal and Torres Strait Islander people. This helps ensure that participants are grounded in social and emotional well-being from an Aboriginal and Torres Strait Islander perspective, giving participants the skill to provide mental health first aid in a culturally safe and informed way. The course equips adults who teach, care for or support young people with the skills and confidence to recognise, understand and respond to an Aboriginal or Torres Strait Islander young person experiencing a mental health problem or mental health crisis until professional help is received or the crisis resolves. The strengths-based course ensures participants are grounded in social and emotional well-being from an Aboriginal and Torres Strait Islander perspective and is tailored to include cultural considerations, protocols and yarn-ups. It teaches participants about the signs and symptoms of common mental health problems and some of the challenges facing Aboriginal and Torres Strait Islander young people. Participants learn how to recognise and respond to emerging and worsening mental health problems and the supports available. Using the Mental Health First Aid Practical Action Plan, participants learn how to approach someone they are concerned about and how to hold safe and supportive conversations about those concerns. The course covers specific types of mental health problems that can affect young people and how to apply mental health first aid in a range of crisis situations, including suicidal thoughts and behaviours, panic attacks and substance use problems. Our Youth Aboriginal and Torres Strait Islander Mental Health First Aid course is a culturally responsive training that empowers school staff, adults, family and community with the knowledge, skills and confidence to recognise and respond to mental health problems in young people. The course has been developed and reviewed in consultation with First Nations people. This provides much needed cultural context to community-based care. It is for Aboriginal and Torres Strait Islander people and those who support our people. Research has found this course to be effective and culturally appropriate, educating and empowering our communities to assist Aboriginal and Torres Strait Islander young people experiencing a mental health problem or mental health crisis. This course supports information about mental health first aid and self-care into Aboriginal and Torres Strait Islander communities. Developed through the expert consensus of people with lived experience of mental health problems, caregivers and professionals, this course considers local perspectives and experiences and utilises lived experience stories as well as Aboriginal and Torres Strait Islander photography, film and artworks. This representation matters and leads to better outcomes for those participating in the training and the young people they go on to support. This 7 to 8 hour course can be delivered in one of 3 ways: 2 face-to-face sessions, a blend of e-learning and face-to-face learning, or e-learning combined with an online session. All sessions are delivered by an Aboriginal and Torres Strait Islander mental health first aid trained and licensed instructor who can draw upon their unique and instrumental local cultural knowledge to enrich course content and enable culturally informed and safe delivery. The course is suitable for school staff, parents, carers and any adult interested in learning more about supporting Aboriginal and Torres Strait Islander young people.